Hi everyone, welcome to another presentation from MASH, Minimal Access Smart Surgery Hospital. I'm Dr. Sachin Ambekar, Medical Director and Director for Minimal Access Smart Surgery Department. Today I thought let's speak about a hernia which probably not many of you have heard about. I'm sure you've heard about inguinal hernias, umbilical hernias, femoral hernias, ventral hernias, but today I'm going to talk about a different entity called a hiatus hernia. Now, what is a hiatus hernia? What happens is, I would like you to see on my screen, basically, this is the normal stomach and this is a hiatus hernia. Now, what happens is the stomach comes through a muscle plane called the diaphragm, and there is a small hole for the food pipe and the stomach to connect. Now, eventually, what happens is the stomach part, which is in the abdominal side, which is at the upper abdomen, goes as a hernia and transits into the food pipe area. So the hole which is here, you can see this is the normal stomach, and the hiatus hernia is a bulge where the stomach is traveled up into the food pipe. Now, what are the types of these kind of hiatus hernias? Generally, we have four types. The type 1 is a sliding hernia where the part of the stomach bulges and goes into the food pipe. Then you also have a paraesophageal hernia, that's a type 2, where the stomach and the food pipe are in the same dimension, in different dimensions, but the some part of the stomach comes to the side of the food pipe. So it is on the lateral side of the food pipe, and that's called a paraesophageal hernia. And type 3 is a combination of both. And type 4 hernia is when the whole stomach and some other organs herniate through the diaphragm and enter the food pipe. So, what happens next? How do you come to know about these hernias? You need to visit your doctor, gastroenterologist, or your surgeon. But foremost, how does it get diagnosed? What are the symptoms? So, the most common symptoms is acid reflux. Also, sometimes it is a part of GERD, that is gastroesophageal reflux disease. The most common symptoms the patients come up with is belching, burping, having acid reflux or the taste of acid in your mouth, especially when you're lying down, when you have the stomach contents coming back after having food into the food pipe, vomiting, cough, atypical pneumonias, asthma, which is a result of the acid reflux of the stomach. Now, what actually happens? Basically, the lower part of the esophagus has got a valve. So, that is called the lower esophageal sphincter. Now, what happens with the sphincter? It's a valve. It is supposed to push the content into the stomach, and where the acid churns the food, everything goes down. But when you have a lax, when the sphincter is very uh, lax, it is very loose, then the acid which is in the stomach goes back into the esophagus. So it's a travel back procedure. That's where the symptoms come, because the acid is supposed to be in the stomach, but it is coming into the food pipe. Hence, you're getting the acid reflux, you're getting heartburns, you're getting belching, you're getting burping, you feel full bloated, which is called as postprandial fullness. And on the later part, as the disease progresses, the part of the food content which you've eaten also comes back, and especially in lying. Now, these are the most common symptoms, and also you have cough which has been persistent. You go to a physician, you do an x-ray, you do not have viral fever, you do not have any other symptoms for the cough, reasons for the cough, but then the part of the cough is because of the hiatus hernia, which doesn't get diagnosed, unfortunately. Now, the prevalence is about 30 to 40% in our Indian population, especially at the age of 40 to 50 and 50 and above. Now, what contributes to this hiatus hernia? Which percentage of people can get hiatus hernia? People who are obese, who are fat. There is also a genetic predisposition where, from generations to generations, this has been transformed and mutated into your genes. The lifestyle which you lead, having uh, late night foods, is also a composition which causes GERD, and later on, probably because of a lower esophageal sphincter which is very lax, can contribute to the hiatus hernia. Increase of the intra-abdominal pressure can also lead to hiatus hernia, like chronic constipation, cough, etc. Smoking is another contributory factor which can lead to this hiatus hernia. Now, these are the most common reasons which I've explained for hiatus hernia. Now, how does it get diagnosed? So, with all this belching, burping, and all the GERD which you're having, you generally tend to take some antacid lying at home, and then you think, no, I don't think I need to go and see a doctor. But over a period of years, it becomes a social embarrassment. You're sitting and you're belching and burping. So when you go to the doctor, the first thing the doctor would probably, a physician would prescribe you medicines and ask you to get an ultrasound, which at some point of time is not very contributory. So what exactly do you need? How do you diagnose hiatus hernia? It has to be done, point number one, through endoscopy, which is done by a gastroenterologist. And nowadays we have manometries. The recent ones are impedance manometry, pH manometry, which reads the pressure of the reflux in the food pipe. So endoscopies and manometries are the gold standard for diagnosing hiatus hernia. Now, the most important part, what next? Do you need surgery, or it can be done with medications? So I think the answer to this is complicated, because not every hiatus hernia needs to be operated. Yes, you've heard that right. Not every hiatus hernia needs to be operated, especially if you have the stage 1, which is just a small sliding hernia. Any hernia which is below a 3 centimeter and not very asymptomatic, need not be operated. It can be taken care with medications like proton pump inhibitors, a lifestyle change, a behavioral habit, and obviously vices like smoking and alcohol needs to be stopped. Late night foods need to be stopped. So these are some of the treatment plans for people who have hiatus hernia. Now, which patients actually need surgery? Surgery is recommended for those patients who have tried all kind of medications and still the symptoms are persisting. If the medications have failed and the symptoms are persisting, if you have a stage 3, stage 4, like a combined hernia or a paraesophageal hernia, or a hernia which is bigger than 2 to 3 centimeters, which is causing acute symptoms, yes, you need a surgery. Now, what is the surgery? The surgery has become minimally invasive. As we do in MASH, we do a laparoscopic repair. We repair the hernia, and sometimes we do a anterior wrap of the stomach to stop the reflux. Now, these are the treatment options. How fast do you recover from the surgery? Within 24 hours. Within 24 hours, you're back home and you do not need to have any kind of expertise to do any dressings. They're minimal invasive, portholes, no dressings to be done, and you're back to work. So I think I have concluded mostly about hiatus hernia. If there are any more queries, you can reach out to us at MASH. Thank you very much. Take care.